to English. And a box will open at the top of your screen where you can choose what language you would like the captioning translated into. We also have someone here to translate questions for Spanish speakers. And before we get started today, we want to remind you that this meeting is being recorded and it will be available on Friday on the DSPD website. It will be under the Individuals and Families tab and then the Be Informed and Be Involved. Please mute yourselves and type any questions into the chat box. That just helps keep it so everyone can hear the conversation most easily. And I'm going to give a little bit of time to Nadia so she can do that intro in Spanish. So, Nadia.
Thank you, Angie. Buenas noches, bienvenidos a nuestra reunión familiar y autodefensa. Esta reunión está siendo grabada, así que le pedimos que por favor ponga su micrófono en mudo. La grabación la puede encontrar el próximo viernes en nuestra página del internet. Para verla, vaya a dspd.utah.gov. Luego presione en Individuals and Families, Resources, Be Informed and Be Involved. Usted puede encontrar la grabación de la última reunión, así como reuniones pasadas. Estamos haciendo todo lo posible para tener esta presentación en otros idiomas, pero por ahora solo tenemos disponibles los subtítulos. Si desea usarlos en español, siga lo siguiente. Presione el círculo que tiene 3 puntitos. Presione la cajita de abajo que tiene las 2 CC mayúsculas. Presione la cajita de la derecha que dice English Caption Settings. Va a salir en medio otra pantalla y presione Translated Captions y verifique que se ponga en azul. Luego presione la X en la esquina de arriba a la derecha y los subtítulos estarán en español cuando una persona esté hablando. Si tiene pregunta, a la mano derecha en la parte de abajo hay un cuadrado con líneas. Presiónelo y saldrá una segunda pantalla que dice In-Call Messages, en la cual usted puede escribir su pregunta. En la parte de abajo hay una línea que dice Send to Everyone. Ahí usted puede escribir su pregunta en español y yo se la puedo traducir. Luego presione la flecha para que podamos verla. También puede hacer preguntas en voz alta, solo presione el círculo que tiene la manito. Le haremos saber cuándo puede hablar. No se olvide de presionar el micrófono para que la podamos escuchar. Si desea mandar sus preguntas por correo electrónico antes de la reunión, las puede mandar a dspdinfo@utah.gov en español. También se las traduciré. Estaré presente y disponible durante toda la presentación en caso de que tengan alguna pregunta. Gracias. Back to you, Angie.
Thank you, Nadia.
Yeah.
We'll be going over our agenda today. We have announcements. We'll go over some staff changes, legislative updates related to progress on caregiver compensation. We'll have some person-centered planning training, and then with our community resources, we have the Human Services Research Institute. They are completing our long-term services and support studies for disability and aging services. So we're really grateful to have them here with us. And then we'll have time for our questions and answers. So we'll go ahead and just start with our announcements. DSPD is holding a series of work group meetings with families, with providers, and with support coordinators. Each group is having their own work group to get feedback about integrating rights restrictions data within the person-centered support plans. The work groups have had their initial meeting in October. They'll have a meeting in November and December, and then they'll be wrapping up in January, finalizing their recommendations and giving those back to DHHS for review. So we anticipate starting construction on the rights restriction process in USteps. That's our case management system, our provider interface, and our family interface, which is called My Steps. After that point, so that families, providers, and support coordinators can collaborate with each other and contribute to the process. We also, in partnership with the University of Utah, we're interested in learning more about the experience of Utah's caregivers of children and young adults. Postcards to complete a survey called the Raising Utah Children Study has been sent out to random households across the state. If you've received a postcard, please consider filling it out. Filling out the survey to share your experiences, and then you also get a $10 gift card. If you have questions, please reach out to Shauna Ayers, and we'll go ahead and put her email in the chat. I'll go over some staff changes. Both of our assistant directors are new. Dean Weenan, he has started as our assistant director of operations. We intended to have them introduce themselves today, but due to like an unexpected conflict earlier, we'll have them introduce themselves next time. But Dean Whedon is our assistant director of operations. He comes with a lot of background in our service system. He's also worked at the home program up at HMHI, previous called the Uni Home Program. Marcy Platt is our assistant director of programs. This is so new that we have not even sent out the email introducing her. But because we are meeting today, I wanted to make sure to share that with you. And she's been with DSPD. She is replacing Jamie Withrich's position, and we're very excited to have her experience in direct services as well as administration of services, coordination, problem solving. We're really excited to have her in this role and are grateful for that. We have Scarlett Uda, who's been on our request for services committee, and she's moving over to supervise the limited supports waiver team. So she'll be the waiver manager there. We have Jeremy Kellogg and Elisa Ferguson, who have joined our emergency services management committee. That is our committee where we're looking at the more critical kind of crisis scenarios, and it's where we use our attrition funding to help to be able to bring people into services in when they're in this kind of crisis. One thing that we're doing there is we are having staff within DSPD remain as the case managers for this first year of service for people. There's a lot of work to be doing related to like getting their Social Security, Medicaid, and other kinds of things, and just a lot of changes up front as they are coming in and in response to a pretty critical situation. We're hoping that'll help things be smoother for people, get things in place more quickly, and be a little bit more responsive to changing needs. So we're excited to have them in their roles. Tim Lewis is now working with Bruce Qualia. He's our new division technical writer. That they're the people who help us like draft the rules, draft the directives, which are our policies and procedures that really help guide how we're interacting, how we're supporting people. So we're excited for him. Danielle Ibsen and Emily Williams have joined our payment support team. We have Alex Keopanya. He's joined the accounting and budgeting team as a financial manager. We also have Jacqueline Sells and Rachel Glad. They are on the RFS team on a temporary part-time basis using ARPA funding. Both people have someone on the waiting list, and that was something that we intentionally used the ARP funding for. We wanted to make sure we were able to be we love having families and people with lived experience working at DSPD, and we love to be able to have that perspective. So we wanted to make sure we did that. We also have Bridget Allen, who filled an open existing position on that committee as well. Tony Bettino is new to our intake team. And then Marissa Bowen is on our team that is helping people transition from intermediate care facilities into the community. We're really excited to have all these people start. And hopefully this helps you. If you have people you need to reach out to, it helps you identify maybe who those people are, and just kind of hopefully keeps you informed about where we're at and who's available for you. So I'm happy to share those with you. Our next is legislative updates, and our update here is really the work that's been going on around caregiver compensation, around that program. So first of all, thank you so much for reviewing our caregiver compensation plan, the draft plan. We asked for feedback on the draft plan and everyone delivered. By the time our public comment period ended on October 29th, we had received 474 responses to our feedback form. So thank you so much. Right now, we're going through and reading all of the responses and feedback about the draft caregiver compensation program, and this will give us a better idea of what changes we may need to make to draft the plan before this program starts. We've already changed one thing. In the draft plan, we said the program would start in December. We moved that date back by a couple of months. We're now planning to start the new caregiver compensation program on February 1st of 2024. This gives us more time to go through the feedback, consider it, and then make any needed changes on the draft plan. If you are in DSPD services and are using the temporary caregiver compensation program, we want to make sure that you don't have a gap in services. We sent instructions to your support coordinators explaining how they can request to extend your caregiver compensation services through January 31st of 2024. This way you won't have a gap between the old caregiver compensation program and the new one. If you have more questions about this transition period, like the transition period, please talk to your support coordinator. We have received many questions from you about the draft plan. We drafted some answers to the most frequently asked questions, and we'll post the link in the chat. And then also I'll go over these when we get to the question and answer, and when we're taking further questions. Now I'm going to turn some time over to Bryn Peterson and Lisa Wade to go over some person-centered planning.
Thanks, Angie. It's great to be with everyone tonight. I'm Bryn Peterson. I'm part of the employment planning and inclusion team with DSPD here. We're just going to talk about a few person-centered planning skills and some tools with you tonight. So this will be great. So listed here on the screen are the 5 competency domains for staff who facilitate person-centered planning. This is published by a national organization called the National Center on Advancing Person-Centered Practices and Systems. If you want more information, you can download the booklet on their website, and we'll put a link to that in the chat. They've also published a plain language version of these competencies to describe them in a way that's a bit more accessible. And we'll put both of the links in the chat for you. Tonight, we're going to focus on that bulleted competency, which simply is rights, choice, and control. Go to the next slide there. Okay, so we want to start with just a basic statement about what it means to encourage rights, choice, and control for you or your loved one. Simply, that means that the person-centered planning process is based on respect, that people can make their own decisions, and understanding that at times people might need help to learn about their rights, participate in planning, and communicate their vision for what a good life looks like for them. People in services and families can expect that those leading these discussions and conversations, and then later the direct staff, that support that they receive, will always be presuming competence, meaning that all people have the capacity, right, and ability to participate in the planning process. The support team facilitating planning, and then later that direct support staff are always embracing also this concept of dignity of risk. Dignity of risk means that people have the right to fail and learn from their mistakes. And really, unless there's an emergency situation, there should not be limits or restrictions put on a person's freedom or activities only out of a desire to protect them from their choices, or limit the freedom to make those choices only because it's in their best interest. Dignity of risk is allowing a person to make independent decisions, knowing that they're taking on some level of reasonable risk and consequences, either good or bad. So next in this competency, support team members leading in a person-centered way, keep people informed about their rights in the service system, and in the community, including to be free from discrimination. Advocacy is really at the center of education on rights, and that is a chance and opportunity to learn about the history and achievements of disability and aging advocacy groups. We today are the beneficiaries, all of us, we're the beneficiaries of past and present disability advocates who maybe one example is push for equal opportunities in employment. A second might be equal access to full education for all. And maybe a third is making sure that communities are accessible to everyone. Those are just a few examples. So continuing on with this skill, with skills in this competency, that requires that person-centered facilitators encourage people to speak up for themselves during the person-centered planning process, especially when preferences are not being honored. During that planning and support time, a person-centered approach is providing support in times where there might be a conflict or a disagreement, and practicing supported decision-making. Supported decision-making helps the person to make and communicate decisions about their life. And we're going to share some resources to help do that well in a few minutes. The approach to decision-making should be used whether or not the person has a guardian. So really in both of those situations. And it's especially important when we're considering a human right. So a human right is a right that's available to everyone, things like privacy, dignity, and respect. And if that right's being restricted in any way, then there's a process that needs to go through. And so this is a way to consider, this decision-making piece is a way to consider that when you're thinking about restricting a right. We also want to acknowledge that a person-centered approach means that staff and support team members learn and know what signs of abuse, neglect, and mistreatment look like, and that all of us know who to contact in these situations and really how to report. So I'll give some time to Lisa to talk about some of those person-centered planning tools.
Thank you, Bryn. Lisa Wade with the Employment Planning and Community Inclusion Team. Happy to be with you tonight to talk about a couple of tools that we want to share with you that support this competency of rights, choice, and control. And I'm going to talk about a tool called the Exploring Decision-Making Supports, and a link for that tool we put in the chat so that you could pull it up and look at it if you'd like while I'm talking about it. But this tool identifies which areas a person will or will not need individualized supports to make those important decisions. The tool identifies 3 decision-making areas. One area is things that I can decide with no extra support. Another area is that I need support with my decision. And the third area is that someone will need to make the decision for me. The tool uses the life domains identified by charting the life course with questions in each domain area. The domains include daily life and employment, healthy living, social and spirituality, safety and security, community living, and advocacy and engagement. So under each of these domains are questions meant to be answered and also spark other questions within each domain that might be more unique to the person. This tool can both inform where a person can make the most independent decisions possible, as well as where the support team can begin creating goals around building self-advocacy. And for parents, it can help you know when to step in and provide some support, and where you can step back and let your loved one take the lead in making the decision. And especially important for those individuals who are transitioning to adulthood, this tool can really help you as a parent prepare them to be as independent as possible in their decision-making, help you see where there's gaps and where they might need more support. On the next slide, we have an example of the questions under the daily life and employment domain. And as you read this, keep in mind that everyone uses some supports for some of their decisions. There aren't many people that are completely independent in their decision-making. And as a reminder, the answer options are, I can do it on my own, I need support, and I need someone else to make this decision. So how would you answer these questions? Can I make big decisions about money? Do I make everyday purchases? Do I pay my bills on time? Do I keep a budget so I know how much money I have to spend? So think about the supports that you might use as you answered those questions. Do you have trusted people in your life that can help you make some of these decisions? Are the supports you use always people? I know I use technology to help me know how much money I'm able to spend and keep track of my budget, and even to pay bills through electronic bill pay. So as you're thinking about supports, it doesn't always have to be people, but you can set up systems and processes that can help to support someone in making their decisions. Now I'm going to talk about another tool that can help you cultivate this competency of rights, choice, and control, and that is the employment pathway tool. And again, we'll put a link in the chat so that you can look at it while we're talking about it. And I'll give you a heads up, we have an updated, more colorful, engaging version that we're working on, and it should be available soon on our website. As a reminder, all individuals who are receiving DSPD services who are of working age, which is ages 14 to 65, should have the opportunity for informed consent around employment every year. The employment pathway tool is where our support coordinators can document the options, the experiences, and the information a person participated in throughout the plan year, and note their reactions to each of those activities. Providers are responsible for scheduling those experiences and activities that are tied to the person's interests. This is of particular importance for individuals who aren't working, so that they can have exposure to what a job might look like. The develop section of this tool is a great place to keep record of all of the activities and experiences an individual wants to explore around employment. It can help identify interests and activities the person wants to participate in, which can help with planning what to do when they are with their staff. Parents, you can use this tool whether or not your child is in services to document their interests and connect them to possible employment opportunities. On our pathway tool, next slide, there are 4 identified pathways. Pathway A, a person is unemployed and expresses interest in work. Pathway B, the person is unemployed and expresses they do not want to work right now. Pathway C, the person is working but desires a change. Or pathway D, the person would like to maintain their position and continue to grow in their career. We would expect these positions to change throughout a person's life. I know they have changed throughout my life. There's another person-centered planning tool that this pathway tool is another person-centered planning tool that allows a person to give input and direction, choice, and control over what they want in their life. It can help them communicate their feelings about employment at least yearly with a support coordinator for those who are in services. And again, I encourage parents to become involved in this process as well, because it can be created and updated by individuals or families at any time, especially as interests or situations change. We hope that these tools will support you in becoming more person-centered and giving choice and control to your loved ones, but know that we are here to help. So please reach out to us, our team, with any questions, and our email contact will be put in the chat. Thank you so much for your time tonight and for letting us share these tools with you. Back to Angie.
Thank you so much, Bryn and Lisa. We really appreciate the work they do, and we're hopeful this is helpful for you as we implement services and we strive to support people and their families. We want to help people thrive. We want them to have be meaningfully engaged in their communities, in their homes, in their lives. And these are tools that we use to try and help achieve that. So we're hopeful that these are helpful for all of you. So again, thank you, Lisa and Bryn, for sharing all of that. And I think it's fair to say, because I know you guys, I hear you say this a lot. If you guys have questions on how to implement them, do feel free to reach out to Lisa and Bryn. They do a lot of just consultation and working with people one-on-one to kind of work through things and implement things. So please know that that's something that they enjoy doing. So just putting that out there. Now we have the Human Services Research Institute here. They're going to be presenting on our long-term services study engagement. We had it looks like Jasmine is here with us tonight again. We're excited to have her. So I'll give the time over to her and she'll be presenting her own slides, I think.
Thank you, Angie. All right, let me go ahead and I will share my slides. All right, is everybody able to see the slides that are on the screen? Okay, great. So hello, everybody. My name is Jasmine Hepburn, and I'm here today representing the Utah Long-Term Services and Supports Research Project. I am the project coordinator on this project, and I work for Human Services Research Institute, or HSRI, who's leading this project. And we're here today, or I'm here today to kind of give an update on the project. We were lucky enough to attend the August meeting where we had some great engagement. So we're here to kind of give an update. All right, and before I dive in, I wanted to just kind of give an overview of what this project is in case anybody needs a refresher, or maybe this is your first time hearing about our project. So the purpose of this project is to learn from people in services, family members, providers, advocacy organizations, and other community members about what's going well and not going well in the service system. And so this project, we are doing research as well as using feedback to make recommendations, which we will then present to the Department of Health and Human Services. And I just saw a question pop up. Is the Human Services Research Institute, so a state-sponsored project or federal? And Angie, maybe I will hand that question over to you quickly.
Yeah. So we actually received funding for this through the legislature. It was sponsored by Senator Iwamoto, and we're also using ARPA funding to help fund it so that we can make sure we get a good, robust assessment done of our system. So we have a little bit of a hybrid.
Thank you. All right, so that is a little bit about an overview of the project, and the goals of this project is we want to learn about how to meet people's wants and needs in a person-centered way, how we might suggest structuring services, at creating a greater capacity to serve more people, and expanding individual choice. So our first update is that we have held our first steering committee meeting. This is a group, our steering committee meets quarterly. So the first meeting was in September, and we'll have another meeting in December. And the steering committee is made up of representatives from the disability and aging networks in Utah. So this is people with lived experience, family members, and representatives of different organizations. So we had and the purpose, or how the steering committee kind of fits into this project, is they help kind of guide our research, and they help us to craft the recommendations that we'll ultimately produce in our report. All right, and so that's a little bit about the steering committee. And we've also been working on our initial engagement plan as we've prepared to really dive into our research. We want to make sure that we're engaging with people and getting a lot of feedback, hearing what's important. So to do that, we're going to have interviews with our steering committee members. We're also attending existing meetings, such as this meeting. And we've got a couple of others scheduled and are outreaching for more. We've got an upcoming meeting with the Independent Support Coordinator Association, or ISCA, as well as the DD Council. But we're always open. If there are other meetings, please let us know that if you think that we might be able to connect. We're also planning town hall style engagement sessions in January. And these are going to be broad, open engagement sessions. We currently are expecting to hold 4 sessions, which will be for DD professionals, people in the DD system, including people on the waitlist and family members, as well as professionals in the aging network and people in aging services and family members. Oh, thank you. Yes. Yes. And now to clarify, so when I said the DD Council, that is the Utah Developmental Disabilities Council. Thank you, Angie. All right. And so we wanted to ask a few questions of you all, and this will help us in our engagement. So the first question is, which groups should we connect with to learn about what is currently happening in Utah? Below that, we have the question in Spanish as well. And excuse me, the second question that we wanted to ask is, what channels should we use to outreach for engagement opportunities? And when we say channels, we are talking about maybe physical flyers that would be posted in the community, or maybe a post on Facebook or Instagram, or maybe there's a website that you go to that you really get a lot of information from. We'd like to know about that so that we can make sure that we're sharing if we have opportunities to hear from you. I will put these questions in the chat, and then I will move to a slide where we have a feedback form. But you're welcome to also post any responses in the chat, which I think I see some coming through, or you can come off of mute and ask a question. So I will now put these questions into the chat. All right. Okay. We have those posted in English and Spanish. All right. And let me see. I see that something has come in. How are we, Christine has asked, how are we selecting the waiting list people to survey? That is a great question. Thank you for that question, Christine. And I see that there's a, I think a recommendation to use the waitlist email for outreach. That's a great point. I'm gonna definitely write that down. Thank you. To my knowledge, I don't know if we have a plan yet to waitlist or to contact people on the waitlist. So this is really excellent feedback. Thank you so much. Okay, I will take that down. All right, and then I'm going to move us to this slide. And so here we have a link that I will put in the chat. That takes you to our feedback form. We also have on the right side of the screen a QR code. So to use this code, you can open up your phone and open your camera. And if you point it at the screen, at this black and white square, a link should appear that you can click on, and it will bring you to the feedback form. So there's a couple of ways, and you don't have to use this feedback form, but we wanted to offer it in case you think of something that you want to share with us, maybe after this meeting is over, or if you prefer to type out an answer. So that is in the chat. And if anybody has anything that they would like to share, please feel free to drop it into the chat or come off of mute. All right. I will give it another minute or a few more seconds, and then we'll move on. But please feel free, if you have anything come up, to either use this feedback form or drop it in to the chat. I see that MD has said email is a good channel. Okay, that's great to know. So I'm hearing that email is a good way to let people know about outreach opportunities. I have a follow-up question. Is there a particular like list that you are a part of, or like a organization that you get emails from? If so, please let us know. Maybe we can connect with them. All right. Okay, well, so just to move us along, so I just want to thank everybody for your time and for letting us come and speak with you. I will drop my information into the chat. Again, my name's Jasmine, and I'm the project coordinator on this. Please feel free to reach out at any time with questions about the project, or if you have ideas for outreach or engagement, or if you know of any resources. We would love to hear about them, and we very much appreciate it. Okay, and I see a note, the Utah Parent Center email list. And there's also a question of if we are researching what other states' best practices are, which, yes, we are also looking at other states' best practices. We have a set list of research topics, and a part of each research topic is looking at what is happening in other states. That'll help us create our recommendations. Okay. Okay, and I see that we have another comment. I would recommend Utah Developmental Assessment Clinic was front lines to what is happening from parents. Also, I would strongly encourage outreaching to therapy businesses, OT, speech, physical therapy, etc. There are community events who have resources and that have a presence, which is another educational tool for parents. Thank you very much for that feedback, and I will absolutely take that down. I also see the Spectrum Academy. Okay, thank you. I also see, yep, looking at how Utah compares with other states. Okay. And the Children's Center. So thank you. I will, I can hand this back to you, Angie, and I will be watching the chat and be here to take down all the feedback that's coming in. So thank you again, everybody.
Yeah, thank you, Jasmine, so much for this time. And you can see a lot of interest. We're really, really looking forward to this study. We're excited to learn where we have gaps, maybe places where we're doing well, and just kind of how to make our system be responsive for families, whether they have families with developmental disabilities or who are aging. So we're really excited that you guys are taking this on and look forward to the results. Okay, we're now at our question and answer period. What I'm going to start with are the questions, the frequently asked questions that we had sent out, just to make sure everyone has had an opportunity to hear those. You'll probably hear a little bit of repetition from what I shared earlier. And then we had a few questions sent in ahead of time before the meetings. I'll do those, and then any questions that come up in this meeting. So for the frequently asked questions, the first one we had is, who is eligible for the ongoing caregiver compensation program? So the ongoing caregiver compensation program will be one service option available to those receiving DSPD services who are enrolled in a Medicaid waiver program. It's going to be one of the service options across all of them that you have. People on the waiting list who receive one-time respite services might also be eligible to participate in the caregiver compensation program. So please talk to your support coordinator or your waiting list worker to learn more if it's something that you think is a good fit for your family. How will the ongoing caregiver compensation program work, and when will it start? We had released the draft plan and had the feedback closing on October 29th. And now we're in the process of reviewing all of that feedback and looking at our next steps with that. Right now, we're planning to have the ongoing program start February 1st. So just remember that that is a little longer than what the initial start date, what had been proposed. And we did that to make sure we have plenty of time to consider all of the public feedback that we received, as well as give us time to make sure we get a finalized plan out there with time for people to transition. What will the transition from temporary to the ongoing program look like? This new ongoing program will start February 1st. And if you are currently using caregiver compensation through the temporary program, your support coordinator will need to request an extension of your caregiver compensation through January 31st. So please talk to your support coordinator if you have any concerns about that. Our next question is, how are the tiers determined? The draft plan outlines 3 tiers you can be placed in based on the needs of the person and services. Each tier has a different amount of payment the person would receive monthly for providing caregiving services. They range from tier 1, which is the lowest monthly payment, to tier 3, which is the highest monthly payment. And these kind of reflect kind of the spectrum that we have seen utilized over the past couple of years. A person's needs will be determined by 2 assessments that are already performed and updated annually and as needed. So the Utah Comprehensive Assessment of Needs and Strengths, that's also called the UCANS, and the Comprehensive Brain Injury Assessment, which is also called the CBIA. Along with the assessments, people's medical and behavioral support needs will be considered in understanding the level of support needed. People and services should already have one of these assessments on file. If your assessment is out of date, please contact your support coordinator. And both of these assessments can be updated as needed to make sure the person's needs are accurately represented. We have a question that is, can I appeal which tier I'm placed in? Yes. You will have the opportunity to appeal if you disagree with the assessed tier. DSPD is in the process of finalizing the notice of agency action and the hearing rights procedures for appeals involving caregiver compensation. When the process is finalized, DSPD will implement the process through administrative rule, which is another place. Administrative rule goes out for public comment as well. We have a question on medical treatment definition. What qualifies as a medical treatment? A medical treatment is a course of action or a therapy recommended or prescribed by a licensed healthcare provider to manage a person's medical condition. We do not have a finalized list for what would be included under this definition. That's some of the feedback we had been soliciting. But examples could include intensive allergy treatment, injections, ongoing wound care, the use of trachs, seizures, and these are health conditions with a treatment duration of at least 90 days. If you have specific items you feel needed to be included, hopefully we've gotten that feedback through the forms that we've had, through the forms that we put out there. So we appreciate the time that people, again, just appreciate the time that people took to give feedback, ask their questions, as well as make their recommendations. Behavioral treatment definition. What qualifies as a behavioral treatment and who provides the assessment? So a behavioral treatment is a treatment that addresses presenting social, emotional, or behavioral health needs of an individual. The assessment and verification of the behavior treatment will need to be conducted by a board certified behavior analyst. If you have specific items, again, we hopefully got those during the public input. That's another area that we were hoping to get feedback on, and had encouraged people when we were asked. The next question is, how will this work if I have multiple children in services? So families will be able to provide caregiver support to multiple children in services or on the waiting list. So on the waiting list, if they're approved for one-time waiting list support, each caregiver would be limited in the number of people whom they could provide caregiver services based on the intensity of the person's needs. If more people in the family need caregiver support through the caregiver compensation program, a different qualified caregiver would need to provide that care. We have, how could this mix with other services such as respite, and will my budget be reduced? So caregiver compensation is one part of the overall service plan available to people in DSPD services. Each person's situation will vary according to their health and safety needs, meaning every person's budget is going to look different. A person may need other services like a day program or respite to meet those needs. So people in every tier level will be able to request other services as needed. Caregiver compensation is not intended to be added on to the support plan a person is currently receiving. Instead, it's a way for the parent or the guardian to provide the services that would otherwise be provided by a different provider or employer or employee. Each request will be reviewed on an individual basis with the goal of making sure the right mix of services is provided to meet the person's health and safety needs and are in the best interest of the individual when considering their care and preferences. We have a question that's, have you considered adding more tiers to the system or doing away with the tiers completely? So we did get feedback on that throughout our public input, and those are considerations that we're going over right now. Another question was, can I change tiers throughout the year as my needs change? For instance, moving from the school year into the summer. In the draft plan, the tier level is based on standardized objective criteria that focuses on this person's strengths and needs. Much of that data will be used to determine the tier level. Will be pulled either from the Utah Comprehensive Assessment of Needs and Strengths or the Comprehensive Brain Injury Assessment. We don't anticipate that these assessments will vary throughout the year. If a person's circumstances change enough to require an update on one of those assessments in the middle of the plan cycle, that please reach out to your support coordinator so that we can make sure an update gets completed. In general, the tier will remain the same throughout the year. The program isn't intended to address all the time a caregiver spends caring for their loved one. Another question is, pardon me. Another question is, would we only get paid once a month under the draft plan? In most such situations, the payment to the families would be once a month, but this payment schedule could vary depending on which fiscal agency or provider agency you use. We have a question that says, will this income affect me financially via taxes or other benefits I receive, such as Medicaid, SSI, SNAP, and others? On this question, for information on how this could affect your taxes, please talk to your tax professional. And for information on how this could impact other benefits you receive, please talk to your eligibility worker with the Department of Workforce Services. And we'll go ahead and put a link in the chat where you can reach them, a phone number. And then the final question that we have on our frequently asked questions document is, what documentation will I be required to provide and how often? So a person or family using the self-administered services model will submit a report every month to their fiscal agent and support coordinator. And we had shared a draft version of that monthly summary so you could see what it is. We're really working to find the right balance of making sure we have the right information, enough information, support the service delivery. So we have anything that's needed during audits, as well as making sure that we have the right balance for families. Under the provider model, providers will need to provide a monthly summary for the supported living services and submit that to the support coordinator. I'll go ahead and get to the questions that came in before the meeting. The first one is, why do parents that are caregivers 24 hours a day to adults with medically diagnosed permanent mental and physical disabilities have to have a behavior assessment or behavioral plan from a DSPD approved healthcare or behavioral facility before they are approved for Tier 3 caregiver compensation? I choose for my son not to attend a day program because he has been physically and verbally abused. My son also was physically abused by a home caregiver that was taking care of my son during the time I was employed. On this, really, thank you for your question and this feedback. We're considering all of these questions and all of this feedback as we're working to finalize the caregiver compensation program, and we'll be using the information from this as well. The next question that came in ahead of time was, why can't a parent, spouse, caregiver qualifying for Tier 2 can't qualify for working 80 hours a week? As I mentioned in the last question, we're reviewing all of this feedback, and when the program is finalized, we will be sharing that. We will let you know what changes we made based on your feedback. So really, thank you again for the time you've taken to give us the feedback through the forum as well as today. Our next question was, if moving from out of state with an adult member that is on Social Security, what is the process to transfer services to Utah? Is there a waiting list before an adult member is eligible for a day program or respite services? I think Jamie Douglas is on, and I think she'd be like the ideal person to answer this if she is available.
Sorry, Angie, I was writing a response. What question are you on?
I'm so sorry. It's the one that came in ahead of time. It's the, if moving from out of state with an adult member that is on Social Security. Okay.
Okay, sorry about that.
Yeah, you're good.
Anything related to Social Security, you should reach out to the Social Security Administration. Regarding services that we do have a waiting list, and the disability services don't transfer from state to state. So you would need to work to get onto our waiting list for DSPD. We do have two methods of bringing people into services. One is needs-based and the other is through the limited supports waiver based on lower needs. And the amount of time waiting to come into services varies.
Thank you, Jamie. So the first question we had tonight is, will the $2,000 asset limit be increased? We actually don't. We're not the ones who set that, but we can take that question back. So thank you for sharing it. We can definitely pass it on. Okay, I think we have. So the next question is, if moving out of state, it's actually a repeat. So I think we've answered that one. The next question is, what does rights restrictions mean? I'm happy to answer this, but I'm wondering if Lisa or Bryn, who have been working on this quite a bit, are on and interested in responding to that. We have an answer drafted, and I'm just not sure who put that together.
Angie, we're okay to jump in and answer if that's helpful.
Sure.
So human rights are rights that really every person has and enjoys. Rights to privacy, rights to dignity, or right to respect are some examples. A restriction to a human right happens when a person's prevented from doing something anyone else can do. The home and community-based waiver services you use through DSPD protect those human rights, right? So if a right is restricted during the service time, the restriction must be appropriate, and we need to document that that's happening. If you have questions about human rights restrictions, and what the documentation needs or includes, we have a link we can put in the chat from the DSPD website.
Thanks, Bryn. The next question is, at what point does a person qualify for entering the person-centered planning process? I feel like this might kind of be a twofold question. Lisa, I don't know if you had initially drafted this response. I think if you want to answer it, feel free. I feel like it might be two questions, right? One, when do we do person-centered planning? And I'm wondering if there's a second question of like, how do you, like, when are you able to access services? But Lisa, did you want to go ahead and answer like the person-centered planning process?
I'm happy to do that. So person-centered planning is just a planning process that puts the person that you're doing the plan for at the center. They're leading the conversation. It's all about what they want, their dreams, their hopes, their vision of a good life, and they share that with their support team, whoever that is, and then the support team helps them work to achieve that vision. So individuals receiving DSPD services engage in formal person-centered planning at least once a year with their support coordinator and planning team. But informal person-centered planning is helpful for everyone, people with or without disabilities. I do person-centered planning for myself. We have a great resource on our website with person-centered planning tools and information. And we could put the link to that in the chat. On this website, we have links to resources you can use. We also have a series of webinar trainings that we did on person-centered planning tools and how they are helpful for individuals who are on the wait list as well as in services.
Thank you, Lisa. Our next question is, how are you selecting the waiting list people to survey? I think this might have been a question for Jasmine, and she had, I think during this, I don't know, Jasmine, if you're still on, if you just wanted to respond to that again.
Okay, let me see. Let me make sure that I have this the correct question. Is this the how to get on the waitlist email list?
No, it says, how are you oh, maybe it's the same. It's how are you selecting the waiting list people to survey?
That's a great question. We have not yet gotten to that stage. However, my guess is that it would be a random sampling, but I can definitely, we're hoping to attend these quarterly meetings. So I will make a note and we should have an update at our next meeting. I'll bring that back to our team.
Thank you, Jasmine. The next question is, when do we expect the final draft of caregiver compensation to come out? That's also a good question. We have been working backwards on a time frame to make sure we were able to meet deadlines. But we're also have some legislators who have reached out and want to be able to look at the process as well. And we want to make sure we continue working with them. I think many of you know, some of them have been great advocates in even getting caregiver compensation as an ongoing service in our system. So as we're working through all of that. I don't have any exact timelines yet, but those are things that are like we are definitely looking at when we need to have it implemented by, making sure we have time for families to be able to get their like make sure that they go through the assessments, get their tiers identified, if that's the process we remain with. So thank you for asking, and we will be working to make sure we keep you looped in and updated on the steps, on the next steps. The next question is, what are those assessments again? The comprehensive assessment of needs and strengths, it gets referred to often as UCANs. This is an assessment done in partnership with your support coordinator. And then the other one is the comprehensive brain injury assessment. And this one is updated and completed annually as well. So anyone who is on the acquired brain injury waiver would have that assessment. The next question is, how do you get on the wait list email list? If this question is for us, for DSPD, so you'll want to work with your support coordinator to make sure that your email is in the system, right? In the case for your family member, or for yourself. That's where we pull the emails from so that we can send information out to families. So please work with your support coordinator to make sure that your contact information is in there. Okay, the next question is, when will the additional DSPD dollars allocated by this year's legislature start being dispersed? And when will waitlisted families start being placed in services? So the Utah legislature included $3.6 million in ongoing funds in our fiscal year 24 budget, which started July 1st of 23, for the DSPD waiting list. And with our estimates, we expect about 230 individuals will be brought into services with this funding, and people are brought in across, like, throughout the year. So we've already started that. And people are coming in through both our, right, the most critical need, the highest need, as well as through our limited supports programs. The transition team is working to assign around 13 to 21 individuals from the waiting list to start this process each month. And at our last check, we had around 80 people who already had plans in place, which means they've identified providers or the services, whether they're self-administered, caregiver, provider-based, or a combination. So they have plans in place to be able to start implementing those services. So we'll be continuing to work on that throughout the year, but that's already been initiated. And then I think that was the whole question. I just was rechecking it. The next question is, what are the payment ranges for each tier? So the current draft of the program has these payment ranges. Tier 1 would start at, tier 1 is $1,079.87 plus the $100 for the fiscal agent or provider costs. Tier 2 is $2,159.73 plus the provider, plus that $100 for the fiscal agent and provider costs. And tier 3 is $4,319.47, plus that $100 for the fiscal agent and provider cost. These are not finalized amounts and are still subject to change as the program continues to develop. The next question is, does behavior include prescriptions to control behaviors, or would that be medical? That is a great question. We are still working to complete the list, and more information will be provided as it's finalized. And this is like a great question for us to make sure that we're capturing as we're finalizing this. The next question is the caregiver's compensation taxed? So this is one where you need to reach out to your tax specialist for any questions related to tax liability surrounding caregiver compensation. It's a pretty common question. Thanks for asking. And we're just not the right group to answer that question. The next question is, when can we expect to know which tier we are placed in? I think that is really one of the biggest questions. And I think one of the challenges is that we don't have it finalized because we wanted to make sure we were getting input. So once the program is finalized, we'll send out the information and implementation dates. The next question is, so you are going to ask the families to fill out more monthly paperwork. So currently, under the draft version of the plan, families will need to fill out a monthly summary. This will be instead of tracking caregiver hours in 15-minute increments. The hope is that this will simplify the administrative burden for families who are participating in the program. The next question is, I'm not sure this is the correct platform to ask this question. I would love someone to review this question and answer via email if that is a better platform. Would the question regarding waiting list changes from change from do you have more than one person you are caring for have disabilities to being able to add an actual number of people? In other words, if I have one child on DSPD and 2 are on the waiting list. So we may need to follow up with you. So I'll try and give an answer. Like we've had people working on these responses. And we may need to follow up because I'm not 100% sure if this is what you're asking. So if what you're asking about is the question on the NAQ, so the needs assessment questionnaire, that's a questionnaire that is done for everyone on the wait list annually and is updated as needed. The primary caregiver is caring for an aging parent, ill spouse, or dependent with disabilities in addition to the applicant. So we can add and do notes to this assessment to record the number of children and adults that a caregiver is supporting. And if that, we can reach out to you as well, just to make sure we're answering the question. Sometimes if we don't have context, it can be a little bit hard. So we had a question come in that says, what is the transition period and what do parents need to do concerning this? So right now, I guess I would consider this our transition period, right? We're working through what the future plan is, what the future program is going to look like. We've solicited that feedback from families initially, worked to develop something based on that feedback and have put it out for more input from families. And then we'll be using that to help finalize our program. Right, we're still currently operating under the program that was approved and allowed during the public health emergency. And that is a program that we always knew we would have to, that we would not be able to maintain as it was. It's something and that we had known all along and tried to keep that communication going. So right now, as we're transitioning, what we needed to make sure every support coordinator did for people who are using caregiver comp, because we did have an end date with a public health emergency and had to work on what a different date could be for rolling out our ongoing plan. And so this is the period where support coordinators were emailed and given some guidance on how to make sure they're getting a request in so that you don't end up with a gap in services between what you have now and making sure that you have something that goes up until February 1st. So that should all be in place. I think we've had if not everything, at least most support coordinators have already submitted and completed that. So that's in place for families. Definitely feel free to follow up with your support coordinator if you want to double check and make sure that happened. And then the next question is, can you please let us know if we will be notified in advance before we are assigned a tier so we can make plans going forward? That is definitely part of what we're trying to build into this communication and implementation. Because we want to make sure families are able to like look at their assessments, see where they land in a tier. That's exactly what we are working to do. So yes, and we know that there would need to be time to make sure everything is ready and in people's person-centered plans to be rolling out on February 1st. So we definitely are going to be working to make sure you have time for that. Okay, we have a question. Is there any future use of an app to make reporting easier? I think that is a great question. I was thinking about that myself today. As we heard from parents earlier in the day, we don't currently have an app, but I definitely think this is great feedback for us to consider, whether it's through like My Steps, having an easy way for parents to be able to complete this. I think it's really good feedback and it's something that we should consider. So thank you. Hey, we have another question that says, I really feel like there needs to be a tier between 2 and 3. My child won't likely qualify for 3, but won't be served enough on tier 2. That this is definitely something we've heard, and it's part of what's being considered and evaluated as we're looking at how to incorporate the feedback we're getting and how to move forward with the plan. So thank you for bringing that up. The next question is, will there be an opportunity to provide feedback on the next draft? We're really working to get all of the feedback right now because as we're looking at timing, we want to be able to incorporate what we're learning as well as what we need to be accountable for to the Centers for Medicaid and Medicare Services. So we're anticipating to do a finalized program following our review of the information we've been receiving from families today, as well as feedback from legislators. We know they have some thoughts, as well as families have reached out to them as well. So we'll be working through all of that, because once we do need to be able to get a final draft out so that we can make sure people have time to get their assessments. Right, everyone should have them, but get their tier determined and determine kind of what their plan is, how services look. So we don't intend to have another draft submitted so that we can move forward. But thank you for asking that. We have a next question that's, what's the best way to provide additional feedback? So we gave a deadline of the 29th when we sent out the draft, the initial draft. We are gathering feedback in this meeting because we already had this planned, right? We knew we'd be meeting with families. I would say feel free to send something, but I would say probably by the end of the week, simply because we need a cutoff point so that we can make sure that we're getting the information and we're able to really review everything that's come in. And I do think there is the potential that there could be another like open input meeting. I know there's been a little bit of discussion there, and if there is, that would be probably the final place to be getting that. So thank you for asking, because it really is important for us to hear from everyone, and it is important for us to also just have a point where we know that we are just working with the information we have to be able to get this implemented. So the next question is, will there be public feedback during the next year to see how the program is working? We definitely will be evaluating this over the year, hearing from representatives. I know that they've expressed interest in seeing how this, like once we roll out the implementation, really evaluating how it's working for people. So there is other interest in making sure that's assessed too. So that we really can evaluate the impact and outcomes of doing this. We have a question. Some of the fiscal agents, such as Acumen, do have pretty easy online reporting already. So I feel like that is just more of a statement. Thank you for sharing that. So a question that just came across is, many families might need to have additional services added to their child's plan, like a day program, if their caregiver comp hours are cut. Will this be available? That is definitely part of your planning. So the intent of the planning is to be looking at what are the overall needs of each person, and then making sure they have the services in place that they need. So thank you for asking. Looks like maybe we've reached the end of people's questions for this evening. Just want to say thank you so much for coming. The purpose of these meetings really is for us to be able to share information, keep families informed, and hear back from you as well. So thank you for coming and for your participation. Our next gathering is Wednesday, February 7th, in 2024. And as a reminder, you can find information about the past and upcoming family meetings on our website under the Individuals and Families tab, and then under the Be Informed and Be Involved heading. We'll go ahead and also put like the information for our next Disability Advisory Council meeting. It's next Tuesday. The public is welcome there. So again, thank you so much for coming and for your participation. Have a great evening.